Get ready to reimagine the future of humanity and unlock your true potential. Welcome to Reimagining Humanity's Future and Yours, hosted by Dr. David Gruder, an internationally renowned integrative psychologist, human potential expert, author, and social change catalyst, as he delves into the most urgent issues of our time. With the world facing unprecedented challenges and social and political divides growing deeper, it's time to take action. Each episode of this groundbreaking series will empower you with invaluable insights, strategies, and tools to heal these divisions and restore personal freedom and societal well-being. Whether you're a concerned citizen, a courageous leader, an influential figure, or an ambitious entrepreneur, Reimagining Humanity's Future and Yours will guide you on a transformative journey. Discover your unique role in creating a brighter future for yourself and society at large. Dr. David Gruder will draw upon his extensive knowledge and experience to provide practical solutions for shaping the world we live in. With his passionate exploration of social change, he will help you navigate through the complexities of our time and inspire you to make a meaningful impact. So, prepare yourself for an eye-opening experience as we delve deep into the heart of the matter. Reimagining Humanity's Future and Yours will challenge your perspectives, ignite your imagination, and equip you with the tools you need to reimagine and redefine the world around you. The time to transform our future is now. Join us on this incredible journey and enter a new era of possibility. For more information on Dr. David Gruder and the Reimagining Humanity's Future and Yours, visit www.rhfy.ca. Welcome to Reimagining Humanity's Future and Yours, where together, we create a brighter tomorrow. Now, here is the host of Reimagining Humanity's Future and Yours, Dr. David Gruder.
Well, welcome back to the Reimagining Humanity's Future and Yours show. I'm your host, Dr. David Gruder, and the title of this episode is Reimagining the Future of Dentistry, finally fulfilling its vastly underestimated role in elevating your whole health. Healthcare professionals and the public vastly underestimate the massive role of mouth structure and airway condition in your overall health. My guest for this episode is Dr. Felix Liao. He'll unveil the mind-blowing innovations that are skyrocketing dentistry's impact on health, well-being, and facial beauty in both adults and children. Listen all the way through to discover how to benefit from utilizing these crucial, missing, high-level health cornerstones so you can vastly boost well-being in yourself, your children, or your patients. Born in Taiwan and raised as a scholar-athlete-pianist, Dr. Felix Liao was educated in the United States, first as an engineer and later as a dentist. While attending dental school, his engineering and East-West mindset led him to a pivotal question: why would the body grind down its own teeth? This question nagged him into a career-long quest to find the root cause answer to that question. And what he discovered was that a structurally impaired mouth created airway obstruction during sleep, and that this impairment is responsible for far more than teeth grinding. It grinds down a shockingly large range of health factors. He calls this impaired mouth syndrome. In developing a root cause solution to this root cause problem, he ended up being hailed as the father of epigenetic dentistry and created airway mouth doctor training. These innovations are radically rewriting the future of dentistry, the future of patient care, and the future of catalyzing whole health in adults and children. He has also authored 5 best-selling books on this, in addition to numerous articles in professional journals and ongoing requests for him to keynote at leading edge healthcare conferences. So welcome to the Reimagining Humanity's Future and Yours show, Dr. Felix Liao.
Thank you so much, Dr. David. It's always a pleasure to work with you, and I'm delighted to be joining you here again.
Well, I'm so pleased to have you here on this show. And I said a little bit about how you became interested in revolutionizing dentistry. And before we get to the real focus of this segment of the episode, which is on symptoms that people experience that they don't know are connected with impaired mouth syndrome, is there anything you wanted to add about how you became interested in revolutionizing dentistry beyond my introductory words?
Thank you. Well, that was a pretty amazing introduction, actually. Uh, I didn't start out looking to be a revolutionary. I started out just looking for a simple answer, but it turns out that many symptoms that people have they don't know they're connected to their mouth, specifically their jaw structure. And
Yes.
the mouth is simply been missing in healthcare. And in the process of being nagged by that question into finding answers, I discovered actually that the mouth is missing in all the major healthcare institutions like hospitals, medical schools, and dental schools. Never mind the chiropractics and physical therapy and all the other allied healthcare professionals. So it turns out that the mouth is the source of energy for the body. And it's got a huge role that's being actually X'd out by this huge gap.
Right, and
So,
we'll get into those root
yes,
causes about the mouth in the next
yes.
segment. But for
So
now,
the
yeah,
typical symptoms really are headaches, neck, shoulder, back pain. Typical symptoms could be you waking up tired. Um, Typical symptoms could be moodiness, like depression, anxiety, ADHD, brain fog, and even hostility. Like, why are you so angry? Right? So that's often the result of the mouth structure contributing without the owner or the one who is being kicked by an angry boss, right? How come you're so angry today? Well, long story short, there's nothing that a good night's sleep can fix. And so we'll
right,
get into that later, but those are the most typical symptoms. Chronic recurrent pain, head, neck, shoulder, back, sometimes even hands, sometimes even knees and ankles. All right. And certainly jaw pain, TMJ, clicking, popping, locking jaw joints, um, teeth grinding. Let's talk about the dental side. All right. Because this is what fills the dentist schedule with
right,
patient complaints, persistent dental sensitivities, one dental trouble after another, root canals, failed teeth, uh, lost natural teeth, implants, failed implants, the need to wear night guards, orthodontics relapsing. Um, and this is never just a one-dimensional thing. It's all connected to the rest of the body.
right. And so I'm sure that some of our audience are shocked to even consider that this range of symptoms could be connected to their mouth. I mean, as you say, the mouth has been a missing ingredient in, in a culture in the United States that's a bunch of big mouths anyway. And despite our us being big mouths, the mouth is really neglected. And this is, I think, really, really important for people to understand. And in the sense of professional and ethical responsibility, I want to make it really clear to our audience that we are not implying that all pain or all headaches or all moodiness is because of impaired mouth structure. So just I want our audience to be really clear about that. And at the same time, these symptoms that you just outlined are very common symptoms in people who have impaired mouth structure. And what's really interesting is that when the impaired mouth structure is repaired at a root cause level, and we'll get into how that happens a little later in this program, these symptoms almost always decrease, at least, if not eliminate themselves, disappear entirely. And so it's really important that our audience expand their awareness of factors that can be contributing to symptoms that they're having that they would never in a million years have considered might be related to their mouths. Does that make sense
Totally
to you?
true. Totally true. And we have any number of cases of doctors and dentists themselves suffering from impaired mouth structures that's never been diagnosed medically or dentally. And they suffer the consequences. They go from doctor to doctor themselves as patients. And here's one medical doctor's conclusion. She said impaired mouth syndrome is rampant in America, and we don't get any training in the mouth regarding the mouth structure. And so
Right.
if the doctors don't know, how can patients be expected to know?
Exactly. And on the other hand, the more that patients understand what we're covering in this episode, the more pressure they can put on dentists to expand what they're capable of doing with their patients. So it's top down and bottom up. Dentists
Correct.
becoming more aware of this and consumers demanding more of these interventions from dentists.
Correct. But because the mouth is missing in medical and dental and indeed all the healthcare curriculum,
Mhm.
there is not a department of the mouth in medical schools or any hospitals. So
Right.
dentist do teeth, doctor do mind and body. Guess what got left out?
Right.
And
The mouth. Yes,
yeah,
yes.
the missing mouth. Okay.
The
And the
missing
mouth
mouth.
is actually huge.
Yes, it is huge. And, in the field of linguistics, there's a term called empty category. And what an empty category is where a phenomenon is occurring that has no name. That's why it's called an empty category. And when a phenomenon is going on that has no name, there's no way to develop conscious relationship with it. There's no way to recognize and identify when the phenomenon is occurring, and let alone clarity about what to do about it. And so the reason I'm bringing up empty categories is because you are the one who coined the term for a crucial empty category in healthcare called impaired mouth syndrome. And by giving an existing phenomenon a name, you opened up the door to the future of dentistry and to the future of patient care and to the future of whole health in adults and in children.
Thank you. Thank you for bringing this point. Uh, while I didn't intend to become a revolutionary, I just wanted answers for my patients and myself. Um, it turns out that when the mouth doesn't work, your health does not work. And so a lot of patients end up going from doctor to doctor, dentist to dentist, one trouble after another. And the more treatment is done when the diagnosis is missed, the worse the problem escalates.
Exactly. Exactly. And that's why I'm doing this episode with you, because we really have to get the word out about this. And so after our short break, my guest, Dr. Felix Liao, and I will delve into root causes of the symptoms of impaired mouth syndrome and mouth and airway impairment that we've discussed in this segment. And so please stay tuned, because we're not only going to go into the root causes, but we're going to inform you about what to look for in the way of a solution to the root causes we're going to be covering in the next segment. We'll be back momentarily. Welcome back. Before the break, my visionary guest, Dr. Felix Liao, and I described some of the common symptoms of mouth and airway impairment, the diagnosis of which is called impaired mouth syndrome. As I already mentioned in this segment, we'll peek beneath the surface of those symptoms that you all, as you're listening to this episode, know about, to unpack the root causes of those symptoms. So, Dr. Felix, what do you see as the biggest root causes of mouth and airway impairment that are causing that massive array of symptoms we've already covered?
So great question. I love to cover this. So think about how we survive and thrive. We need energy. We need our body to work. How do we get energy? Well, the mouth is the major supplier of energy through food that we eat, exercise we do, and the airway through which we breathe. Okay, so the mouth sits on top of the digestive tract and the respiratory tract. All right, the mouth is part of the head. The mouth is part of the body's command and control center. All right, you're missing at least half of the body's command control center when your mouth is structurally impaired. Okay, so what do I mean by a structurally impaired mouth? Because it's going to affect your respiratory system and your digestive system. Basically, your mouth is the admissions office from the outer environment into your inner environment where your health is determined. All right. So we talked about energy production. Well, when you sleep, your body is busy replenishing your gas tank, right? Recharging your battery. What if you spent the night fighting to stay alive? Of course, you'll be more tired when you wake up. All right. And over time, you had to struggle to stay awake during the day, and you'll become more adrenally taxed and eventually depleted. All right. So adrenal depletion lowers your ability to fight infections. It lowers your desire for life, actually. You just don't feel like it. Okay. And that applies to nearly everything, all the pleasurable activities. And you also cannot digest when you're stressed. And now you have a whole bunch of gastroenterology problems. And you also, when you don't sleep well because of a choked airway, and we'll talk about how the impaired mouth contribute to that separately, because that's what I had to figure out. But when you are not resting during your sleep, a whole bunch of problems pops up, and you cannot repair that until the root cause of that is found. And what I have found is that when the jaw failed to thrive during your developmental years, for example, you end up with crowded teeth. What happens? you get sent to the orthodontist office. All right. And orthodontist may be successful or may not be successful. All right. Orthodontist could either enhance or downgrade your mouth capability to support whole body health through alignment, breathing, circulation, digestion, energy, and sleep. So your mouth needs to be able to carry out all of those functions for your health to thrive. And when your jaw fails to grow structurally to do those jobs, so form equals function, function equals health. All right. So when your health is not working, let's reason backwards. Right. What's wrong with the structure? That's very simple logic. So let's look at the structure of the mouth. When you have crowded teeth, all right, so go to the restroom after during the break, hold on your lower front teeth. If you see that your lower front teeth are crowded, you have an impaired mouth, okay? Because your jaw didn't grow enough. Why do teeth bunch up? They don't choose to bunch up. They bunch up only because there's not enough room. So you got a basketball bench that will fit 12 players and you got 16. Of course, you'll get bunched up. Okay. So what happens when the jaws are too small? Well, your airway is too small because the tongue needs to fit between the upper jaw and the lower jaw. The space in between is the home office for the tongue. Okay. Now, when there's not enough room in between the two jaws for the tongue, what happens to the tongue? It goes place. It plugs up your throat. It invades your airway. Right, so when you're sleeping, everything relaxes and the tongue falls further down the throat. Okay, so that's where obstructive sleep apnea comes. When your jaw is small, it's like the front door of your house is not wide enough to move the furniture in. All right. So you need to have enough width for airway to supply your body with oxygen while you're trying to recharge your battery, refill your gas tank. And you may look very peaceful when you're sleeping, but underneath the surface, your body's very busy repairing and maintaining and renewing. And if you don't have enough oxygen, breathing is not optional. You'll struggle. Okay. So what I found is that when you have a 6-foot tiger in a 3-foot cage, meaning the tongue is a regular size and the jaw is too small, all right, then you have a problem with the tongue being driven into your throat. And now your airway is off, and now your neck is off, now your posture is off, now you have pain and you have fatigue. So those are the leading symptoms. But when your airway is choked, your body cannot get enough oxygen. You end up having to grind your teeth to your jaw hard, trying to open up the airway. The body plays that card. When the brain gets enough signals from the rest of the body, says, hey, I'm not getting enough oxygen here. We're turning blue here. Do something. So the body reluctantly grinds its teeth because it's in the way of what? The jaw coming forward to do CPR on itself. Right. So this is actually a grave situation, not to be taken lightly. Teeth grinding is not because your body loves to grind on your own teeth. Teeth grinding is because it's trying to do the next best thing for self-preservation, which is sacrifice teeth so that you can get air, so you don't die or have a stroke or heart attack in the middle of your sleep, okay? So because the mouth is missing, because these dots have not been connected, what happens is that the patient gets palliative treatment, meaning a Band-Aid treatment. Oh, here's a pill. Here's a relaxant.
Symptom control rather than root cause treatment.
So you get that instead of looking at the why. Why do I need a night guard for my teeth grinding in the first place? When I got to dental school as an engineer, the answer that a night guard is the answer to teeth grinding just didn't make any sense to me. It's like, huh? How's that solve the problem? And so it turns out that if most dentists were to ask their patients, well, do you wear the night guard I give you? Because I did ask that question once or several times. And the answer is they don't wear it. And those who still do, they grind on that instead. So nothing got turned off in the way of teeth grinding. The drive for the body is still there. It's just grinding on a different surface. Now, that's a small improvement, but it didn't get to the root cause.
Right.
Yeah.
So you've just unpacked a bunch of really juicy details. And what I'd like to do is try to summarize those to really drive the point home to our audience. And so what you're saying, which should be obvious to everyone, is we need energy for our body to work. And when our mouth is the admissions office in terms of what we eat and the airway through which we breathe, if it's the command and control center and it's structurally impaired, we will not get the energy our body needs in order to work. And that's particularly powerful and important when we're sleeping, because when we're sleeping, our body is in regeneration mode. And so that's when our body, in a sense, most needs oxygen, right? Not that we don't need it the rest of the time, but our body really needs an abundance of oxygen while our body is in repair mode during sleep. And so a choked airway has all of these implications in terms of this is why a choked airway creates all of the symptoms we covered in the first segment of this episode. And a choked airway is caused immediately by the tongue being too large for the mouth. So the tongue recedes into the airway, blocks the airway, and creates all of these energy deprivation problems. And what causes the tongue to be too large is too small a mouth cavity, because, as you said, the jaw fails to develop properly in a structural way while we're growing up. And I'm a great example of this, by the way. You know this, but our audience doesn't. I was in the care of an orthodontist from 4th grade through 12th grade. First with an external, headpiece, and then with braces, and then the railroad tracks put on the braces, and then the rubber bands added to the railroad tracks. And then as those gradually got taken off over the years, those were replaced by a retainer. But guess what? I still ended up with sleep apnea as an adult. Now, fortunately, in my case, it's subclinical. It's not full clinical sleep apnea, but I snore, you see. And so we know that my body is not being fueled properly while I'm sleeping without some help. And this whole thing about teeth grinding being our body's best attempt to move our jaw forward so that we open our airway when our mouth structure is impaired while we're sleeping, that's a really important point that most healthcare professionals don't know, let alone the general public. And wearing a mouth guard, there's a compliance problem. A lot of people won't wear a mouth guard. A lot of people won't wear a CPAP machine. Even if the mouth guard is being used or a CPAP is being used, it's still symptom control, not root cause healing. Exactly. And with that said, after another short break, we're going to get to the heart of the matter, where I'm going to ask my guest, Dr. Felix Liao, to reveal what's needed at a root cause level in order to restore a health-promoting mouth structure and open airway. Stay tuned. We'll be back momentarily. And we're back. In the last segment, we delved into root causes of mouth and airway impairment that are causing a huge range of symptoms that not even dentists and other healthcare professionals connect with this problem, let alone the general public. And in this segment, my guest, the leading pioneer in dentistry's best future, Dr. Felix Liao, and I will illuminate the simple steps or ingredients that are necessary to optimize our health structure and airway to best support our whole health. So, Dr. Liao, there are a number of interventions on the market that at best control symptoms but don't repair their root causes. We mentioned a couple of them in the last segment. What should people be looking for instead of these symptom control measures that are being offered?
Well, you asked the question, why do I have an impaired mouth in the first place? And you look to see what happens when the impaired mouth is treated. Okay. So, very common example, people have head, neck, shoulder, back pain, and they go to get body work done, whether it's massage, chiropractic, or physical therapy or acupuncture. And it's done in a way that's well-meaning, but it misses the oral contribution. The mouth actually contribute a lot to not only sleep and fatigue and poor oxygenation, but it also contribute to chronic pain and the fatigue that comes from it and the moodiness that comes from it. Okay, so the mouth actually, when it's set straight in tandem, in combination with the other treatment, chiropractic, physical therapy, myofunctional therapy, and nutrition, for example, they actually work synergistically. So when the mouth is missing, treatment maxes out at a certain level that falls short of complete resolution because as a root cause, the mouth has been missing. So pain, very common. So what should be done? Well, we have a very simple way to let the body choose where it prefers to be. So actually, the body has a central intelligence agency inside that's in charge of your survival, okay? The central intelligence agency in the brain is actually called autonomic nervous system. So when you trip, you don't fall on your face because you instantly know how to make a correction or compensation, it's called. So all the symptoms come the result of that compensation to a structurally impaired mouth. And so why don't we just treat the impaired mouth instead, or in addition to just the chiropractic adjustment? You hear this all the time. Oh, I feel so much better. And then 2 days later, I need to go back again, right? You're smiling because everybody's been there. So what's missing is something else. So the diagnosis is either not complete or missing. So when in doubt, assume that you have an impaired mouth because the prior treatment has not been working. All right. So how do we do this? Well, very simple. This is home test. You can do this yourself. Pinky test. Should we cover this?
Yes, just briefly.
Yeah. So pinky pad facing forward, put it in your ear, open, bite into your back teeth, pad facing forward, okay? Bite into your back teeth, yeah. If you feel the push back, when you bite into your back teeth on your pinky, you have a jaw that's set too far back, and therefore your tongue is shoved into your throat. Very simple test, okay? 2, you put down and look at your lower front teeth. If they're crowded, your upper jaw is too small for your lower jaw to fit in. So you have a toe box of upper jaw that's like the Prada shoes for the lower to fit in. So that's why the lower front teeth have to scrunch up. This part is too narrow, okay? When the upper jaw is narrow, the lower jaw and the airway pays a price, so does the neck, okay? So when you smile wide and you can see dark corridors in the corner of the mouth and the and your white teeth, your upper jaw is too narrow. So these are all very simple clues that you can tell yourself. That is not taught in medical school, so it's not the dentist's fault. It's not taught in medical school, so it's not your doctor's fault. It's just the state of the art not evolving enough. So healthcare is still in the dark ages where the mouth is concerned. We're still in the dark ages in the sense that we think the earth is flat and the body is complete without the mouth. Well, guess what? It ain't so. The earth is actually round. And with the emergence of the mouth being put back on the healthcare map, you'll find that 95 to 99% of patients need this care.
Yes, 90 to 95% of dental patients need this care. So let me unpack this a little bit too. The dental field and mainstream medicine as well have been in the dark ages for a long time. So in the dental field, drill and fill, braces, symptom control appliances and their variations, medication, and surgery are just well, the surgery is not necessary, and the rest is all symptom control. And chiropractic, for example, or other kinds of spinal adjustment procedures are not enough by themselves if the mouth remains in an impaired state. So the brain dead simple solution to this that has been off the maps until is expand the upper jaw, right? So that the 6-foot tiger in a 3-foot cage no longer exists. The 6-foot tongue in a 3-foot mouth is repaired so that the mouth is a 7-foot mouth accommodating a 6-foot tongue, right?
The tongue does not want to be a tiger. The tongue just wants to be tongue. But when you only have a 3-foot cage for a normal sized tongue, you drive the tongue into the throat where it threatens life. That's why it's called 6-foot tiger, 3-foot cage.
Right.
But the tongue deserves a spacious home office where it belongs, in the mouth.
Right. And so trying to compensate for impaired mouth makes others money while keeping us consumers dependent on lifelong symptom control.
Bingo. You want to spend your money to help other practitioners make money, go ahead. But if you want a root cause solution, you need to find a doctor who is trained in diagnose your impaired mouth syndrome.
Exactly. Now, this should be common sense, but because it's been an empty category, because it's been an unrecognized diagnosis with an therefore unrecognized treatment, what should be brain dead simple is mind blowing. And you've seen this, I've seen this when with the dentists you've been training to become airway mouth doctors, and we'll get into that in the next segment.
And treating.
Yes, treating and training them. They're absolutely shocked that something this simple could actually be a root cause treatment that frees people from having to spend the rest of their lives in an impaired health state and with symptom control measures. So all of these fads that are supposedly about airway health are symptom control fads. They're not really addressing what handles resolving the root causes of impaired mouth syndrome. Am I getting that right?
Yes, and luckily we now have a simple, painless answer.
Simple, painless, drug-free, surgery-free answer.
Yeah.
And So while this shouldn't be revolutionary, it is.
Only because we just discovered that the earth is no longer flat in the field of the mouth.
Yes, exactly. And so, as you said, and it bears repeating, dentists and healthcare professionals of other kinds, it's not like they know about this and they're withholding this from us as patients. They didn't learn about this in med school or in dental school or in chiropractic school or whatever professional training program they came through. They just didn't learn this, and they didn't learn it not because their professors were withholding this information from them. They didn't learn this because their professors didn't know this.
I
Their
had to
trainers didn't know this.
I had to hack my way out of the jungle in quest of that nagging question. Why teeth grinding? All right. It took actually a career, but I'm happy that, yes, now there's a path forward.
Yes, and it really took the combination of you previously being an engineer combined with having an east-west integrative mindset around health that set you up. I mean, your life was architected for you to be the discoverer of this problem called impaired mouth syndrome and the solution that resolves these problems at a root cause level.
Looking back, I think your explanation makes sense, but it sure wasn't comfortable looking for answers, hacking my way out of the jungle.
No, I mean, so much of wisdom is 2020 hindsight. We
Yeah.
don't know.
Yeah.
None of us who are visionaries know beforehand what our life experiences are sculpting us toward being able to bring to the world.
True.
And we only discover that in hindsight.
True. True.
So, after our final brief break, we'll return for our episode's final segment, during which I'm going to ask my marvelous guest, Dr. Felix Liao, to tell us about his marvelous breakthrough, his form of what to look for in a solution that permanently solves a wide array of problems in adults and children without drilling, drugs, or surgery. We'll be back in a minute. Well, before the break, my revolutionary transformation catalyst guest, Dr. Felix Liao, and I delved into what to look for in resolving the root causes of impaired mouth syndrome and the huge range of symptoms that this kind of solution reduces or eliminates. In the final segment of this episode, called Reimagining the Future of Dentistry, finally fulfilling its vastly underestimated role in elevating your whole health, I'll ask Dr. Felix to tell us more about what airway mouth doctors, AMDs, trained by him can do for you, your partner, and your children. I'll then let you know how to learn more about the future of dentistry and how you can get hooked up with an AMD, or if you're a dentist, how you can become an airway mouth doctor. After that, we'll each share, Dr. Felix and I, the big takeaways we hope you've gained from this episode, followed by my closing comments. So, Dr. Felix, Dr. Liao, please tell us what makes Airway Mouth Doctors and your Start Thriving appliance so valuable.
Well, I will answer that from my standpoint as a patient and as a grandpa of my granddaughter, Camilla. So, as a patient, I want root cause solutions. I want natural solutions. I'm not against drugs and surgery. God knows if I get hit by a truck, I want the best medical center.
Me
So
too.
this is not us versus them. This is about a new option to treat a bunch of problems at a root cause level in combination with working with your current doctors. Okay. So this is about teamwork. We work with chiropractors, for example, to straighten scoliosis. That's now possible non-surgically. Okay, we can get kids off drugs because they're sleeping better, their brain is getting the oxygen they need through growing the jaw and the airway.
Drugs like depression drugs or anxiety drugs or ADHD drugs, things like that.
Exactly. All of that, adults, children alike. The brain just needs oxygen. And in the absence of oxygen, instead of compensating with drugs or shocks, why not just restore sleep and widen the airway? So here's what we do. And I'm happy to report that we have a painless solution that, unlike typical healthcare you see, it does not involve shots. It doesn't involve drills. It doesn't involve pills. It doesn't involve surgery. It doesn't involve screws. Doesn't even involve brackets and wires. Okay, so those of you who have had braces know what that feels like. Okay, so it's revolutionary only in the sense that this kind of new healthcare is driven by your body through your own behavior and your lifestyle. And we'll get into that very shortly. But this is not doctor imposed. So those of you who had braces, who perform the brace work? Orthodontist, right? When you get dental work done, the dentist performs it, right? So whatever it is, you go to a chiropractor, the doctor performing that, okay? So this is artificially imposed healthcare. When we try to regrow the jaw, we don't force the body. We suggest ways for the body to restart its growth process. So David, think about you. Whatever your age is, as long as you have sound natural teeth, this will work. We use teeth as handles. We give it a stimulus. The stimulus is the form of an adult expander. You alluded to it earlier. It's called Start Thriving appliance because literally people start thriving once this starts. Okay, so the jaw grows not according to Dr. Felix. It grows according to your genes. How's that? Okay, so CDC definition, epigenetics. Epi means on top of genes. There are two things that we can do to affect gene expression. One, behavior. Two, environment. So what's environment? Well, the air you breathe. If you can breathe through your nose, then you don't have to breathe through your mouth. As soon as you breathe your mouth, your oral environment changes. All right. So behavior and environment of the mouth region. We have a plan that we can offer for the patient to go home and implement. So I am more like a coach. Without the drill, without the shots, without the usual minuses when you go to your dental office, for example. You may love your dentist because they're gentle. That's great. But this is opposite of healthcare as you know it. This is your body having the foot taken off the garden hose so the water can flow to the garden. And guess what? You start thriving, right? So the flowers start blossoming, all right, facial radiance comes back from a good night's sleep, and a tree start to bear fruit, and you start having energy, all right? So think about this. You got sent to the orthodontist because your jaw didn't grow enough, so it looked like you have too many teeth. No. So the answer is to grow the jaw until there's room enough for all the teeth to line up straight naturally. What do I mean by that? The tongue on the inside, the lips and the cheeks on the outside, through normal daily healthy physiological function, will shape the teeth into perfect alignment when the jaw grows enough. So we supplement the expander with a bone building diet. All right. It doesn't make sense to just turn on the expander and stretch the teeth and not give the body something to fill it in with. So this is a change in the oral environment and the oral behavior. And guess what? It's like if you flip on a switch in the room and the molecular assembly line that grew you while you were a teenager during the growth spurt starts to come back online. And it gets the ingredient that it needs to make bone, and this grows. And as the upper jaw grows, the lower jaw comes forward out of the throat, pulling the tongue with it. Sleep gets better. Cheekbones shows up in women, and the smile gets broader, and the mood gets better, and energy rises naturally without having to resort to any kind of pills or supplements or certain stores that you have to buy things from in order to boost your energy and cope with your daily fatigue.
Yeah.
So it's
And
completely painless and gene expression, which means we bring out the best version of you according to the genes you inherited from your parents, your body, not according to me. All right.
right.
So it's like when you go to school and you teach kids, okay, how do you make the most of this kid? Bring them into reality. And that's what actually happens. We individualize the treatment. So your best fit shows up. Yeah.
Yes. So the Start Thriving appliance is a mouth expander. It's a
Yes.
restructurer. So it's a time limited treatment, not a permanent symptom control nuisance. And it's just one component of a holistic integrative approach that allows epigenetics to do its magic to restore us to health. So when I say that Dr. Felix Liao is the father of the future of dentistry and its massive positive impacts on whole health, I'm not engaging in hyperbole. This is accurate in my opinion. So what I want to do, I want to make sure we have time for a brief comment about takeaways from this episode. But I first want to share a link where you all can learn about the future of dentistry and your whole health through Dr. Liao's resources for dentists, for allied healthcare professionals, and for adult and children patients, in other words, for you. And I've got a short link that will take you to that so that it's easier to remember. It's thecess.com. That's THECESS.com. That's my Center for Enlightened Self-Sovereignty /AMD for Airway Mouth Doctors. So thecess.com/AMD will take you to a marvelous site that can help you take your next step, whether you're a potential patient or a dentist looking for training or an allied healthcare professional. With that said, really briefly, Dr. Felix, what is the big takeaway you're wanting our audience to have gotten from this episode?
So when your healthcare doesn't work, look to your mouth because it's been missing in healthcare. If you have impaired mouth structure, you're going to have impaired mouth. You're going to have impaired whole body health issues. And so there is a serious crying need for dentists to become airway mouth doctors, because 95% of your patients are suffering from this undiagnosed. Patients literally are turning blue inside, waiting for this problem to be recognized.
Yes.
And you patients start presenting this talk to your dentist. And those that will listen, you're lucky. Those that will not, reach out to us and we'll be happy to help you find an answer and a
Beautiful.
solution and a provider.
Beautiful. And my takeaway is stop coping with or trying to control symptoms when you can remove their root causes without drilling, drugs, or surgery. Dentists who are trained as airway mouth doctors, AMDs, can help you in ways that no one else can, with integrated root cause solutions that no one else has, so you can significantly reduce or eliminate many of your or your kids' most troubling symptoms and enjoy the truly massive benefits of thriving level whole health. So remember to check out the future of dentistry and your whole health through the forwarding link, thecess.com, thecess.com/AMD. I'm deeply grateful to you, Dr. Felix Liao, for your dedication to helping dentistry enter its best future in having massively more far-reaching impacts on the whole health of adults and children than any other form of dentistry or airway health intervention that I'm aware of. Thank you so much for all you do and for joining me.
Thank you for having me. I love it because all the women will come back looking more beautiful, the men with more energy, and all the children would reach their best face manifested.
Beautiful. And thank you all for joining us for this episode of Reimagining Humanity's Future and Yours. I invite you to explore my main website, drgruder.com, that's drgruder.com, where you'll find a link to watch or listen to all of this show's episodes, as well as a link to the Center for Enlightened Self-Sovereignty, which is helping to dissolve divisiveness and reunite the United States and the world to usher in the age of spiritual self-sovereignty that serves us all around the world, and much more. This has been Dr. David Gruder, inviting you to tune in next time for another spell-busting, uplifting, and actionable episode on how together we can and will build a better future for ourselves and for humanity.
Thank you, Dave.